I count it a privilege to be able to support the people that we look after.
It's a cold day here in Abbotsford, and just behind me is the iHeart office. Now, iHeart stands for the Integrated Homelessness Action Response Team. It's a Fraser Health program that's dedicated to providing healthcare support and resources to people who are experiencing homelessness. And today, we're going to get a behind-the-scenes look at some of the amazing work that they do. They've just finished their morning huddle, so let's go check in with Ashley, one of the team members. Every day, Ashley and a partner meet with people who are experiencing homelessness. Hey Ashley, good morning. Can you sort of take me through why this work is important? The work that not just you, but all of your colleagues here do. Why does this matter?
I think it's important because these are our community members as well, and they have been not able to access the services that we do. And so I think to be able to make them feel as welcome in these services as we are, and to be able to access services that you and I would be able to, is really important.
Good morning, Alex. Today, she's paired up with Alex, who says they act as a bridge between people experiencing homelessness and the resources that are available to them.
I think we fill a really important need in that sense in the community.
See you later.
Bye.
Now that we've met the team, it's time to head out. And I see you've got your naloxone kits, your backpacks. What are we bringing? What kind of equipment are we taking?
We got a case of water. We have our harm reduction bags. So we have one bag full of sharps and one bag full of like smoking equipment. We brought some snacks and food for folks, and we even brought some dog food because we have a dog food donation right now. So,
all right,
yeah,
well, let's go for it.
All right.
iHeart operates in communities across the region. This team focuses on Abbotsford and Mission. In a year, they conduct more than 14,000 client visits. So why do you do this role? What draws you to it?
I think, like, for me, I've had family members and friends that have passed away from the toxic drug supply. So really seeing the loss that I experienced, I know others are experiencing as well. So offering that connection.
I do have some lived experience with addiction and mental health, so overcoming those challenges was huge in my life, and this is a way for me to sort of give back and connect with the community.
We've pulled up to the gravel pit, a local encampment in Abbotsford. This morning, it's a little quiet, but the team says at times there can be as many as 15 people living here.
So we're going to do some, I guess what we call like general outreach. So there's several folks that are living here in the encampment, so we'll just go by each tent and see if anybody's home and see if they need any resources and try and engage with them.
Yeah, and so the people who are living here right now, are they people you've seen before, or is it a mix of both?
I would say with most encampments, it's kind of flexible. There's people that are consistently there, and then we kind of see new faces, sometimes people newer to the community, so really making sure that they know what's available to them.
In 2023, a BC housing report found that more than 11,000 people were experiencing homelessness in our province. What role does stigma play in building up these barriers that keep people from accessing the type of health care that they need?
For their clients, a lot of them fear just what people are going to think when they access these services. How they present is not what people think they should present as. So really facing the fears of that.
And I think one of the biggest things that really is taken for granted is just being a listening ear for folks and being there, somebody for them to talk to and just connect with, and somebody to reach out to. And that can be huge for someone.
Ashley and Alex aren't the only iHeart team members here at the gravel pit today.
Hey, Joel.
Good morning.
How are you?
I'm doing well, thank you.
Awesome.
All right, so where are you standing right now?
You're standing, I'm standing, and hopefully you will too, in the medical van that is part of iHeart, which is a way that we provide care to our clients.
All right, can I take a look?
Absolutely, come on in. So we have an amazing place to provide wound care. We have a bed, and in this is fully equipped with all kinds of wound care supplies. We have a sink even. We can wash our hands. We have a fridge.
Normally, you'd be providing wound care in the elements, regardless of what they are, whether it's rain, sun, snow.
Yeah, this gives us a place to get out of the elements, but it also provides a safe place, and it gives a place of privacy for our clients so that they can have dignity, so that they can talk about things that are concerning them without potentially having other people around that might listen in. So it's an incredible thing that we have been given to use for our healthcare.
After years in more traditional nursing, Tracy joined iHeart.
I just have a real heart for people that are living on the fringes and people that are not able to perhaps get the dignity or respect that they, I think, are owed. Sometimes clients have complex medical challenges. They have cancer. Some of them are palliative care. Some of them are diabetic, and they aren't getting the medications they need. They're not getting to the appointments or getting the tests done to get their diagnoses because they have so many other challenges that are forefront in their mind.
I imagine you're talking about, where am I going to sleep tonight?
Yeah, exactly.
How am I going to stay warm through a cold snap?
Absolutely. And I always think, you know, I'm just fortunate to have had a life where I haven't had to face some of the things that they've faced, and maybe I've had the supports around me that have helped me to be successful or move forward, and they need that. And so that's what iHeart does. We help to be that support that they need.
So Tracy, often you're seeing clients on a one-off basis, but sometimes there are longer relationships that actually last over years, and we're actually going to go meet one of those clients.
Yeah, we are. Yeah, you're going to get to meet Gary, who we first met in the spring of 2022. Gary is very dear to our team, and really he's a success story of how iHeart has really helped him with all kinds of different things to get him to the successful place he's at. So.
All right, well, I'm excited to meet him.
Yeah, me
All right,
too.
let's go. We're in the heart of Abbotsford, where Gary now lives.
Hi Gary, it's iHeart.
Hi there.
When Tracy first met Gary, he was living in a shelter.
Hey,
Hi,
how are you?
how are you?
I'm good, thank you.
Good. I've come to have a visit and see how you're doing. Can I come in?
Yeah,
Okay,
absolutely.
come on in.
Come on.
Wow, your room is looking amazing.
It's coming, it's coming.
Awesome.
I try to keep it clean.
Good. Do you want to have a seat right here and I'll just have a look? I thought I'd maybe have a quick peek at your legs.
Yeah.
Let's just have a feel of your pulses here. Wow. Gary, your legs are looking actually amazing.
Is that right?
Yeah. And otherwise, you doing okay?
I'm doing good, yeah.
You're doing
happy,
good?
Yeah. I'm really happy.
Yeah.
It's the first time in a long time. Yeah.
First time in a long time.
Yeah. You know, I feel just safe, you know.
You feel safe?
I don't have to worry. Everything's going to be okay. You know?
Yeah.
Gary, how has it been working with the iHeart team?
Good. It was the one thing I could look forward to, actually. I can't thank them enough because, you know, they pretty much, they're a big part of my recovery. They saved my life, you know, pretty much, you know. It's a long process, and there's a lot of times when you just want to give up on this and that, but iHeart, you know, it was something to look, it was something that drove me, right? Like I wanted to show I can do it, and I always felt good. You know, they would be happy if I was doing good, and they would just make my day, right? And you have no idea how big of a part it was, you know. You guys really, you know, it was such a big part. You know.
Over the years, the iHeart team was able to help Gary with primary care, access to glasses, dentures, mental health support, and addiction treatment.
You have to be inspired because I used to lose my ambition. Like I'd try for something and you would get so down and out, and then you just give up and walk away. And being without a place to lay your head at night, it's not good, you know.
Yeah.
It's not good.
Yeah.
You know, and I don't want to go back there, you know.
You know, we're just so happy to see you doing so well. It makes our hearts really glad as well. So, yeah.
Now, he's looking forward to the future.
It's a little steps, you know.
That's right.
Yeah, and it's a big thing too. Like it's like I'm 16, going for my license again, right? And so I'm all excited about all these things. Getting my ID, I was excited because I haven't had ID in years, you know.
Yeah.
And just these little things, the things that we take for granted.
Yeah, that's right.
So it's not over yet.
It's one step at a time,
Yeah.
right?
Yeah.
Yeah.
It's not over.